In the previous video on magnesium, we already talked about how much we need each day, why it's so difficult to identify a deficiency, and how to make sure we are getting enough. While it's best to cover our intake through diet, if that isn't sufficient, supplementation can also be useful. In this video, we will dive a bit deeper into the important information and also misconceptions around magnesium supplementation. Who might benefit from it, how much should we take, what are the best forms, and what to watch out for to ensure you are choosing the right product. First, it's quite difficult to compare how well different forms of magnesium are absorbed, because only a handful of low-quality studies have actually been carried out, and they also used very different methods. As we clarified in the previous video, assessing magnesium status is already challenging, so we can't rely on that either. In animal models, it's easier to study because researchers can also measure tissue levels, but since every species have a different digestive system, those results don't translate directly to humans. After going through several reviews on the absorption of magnesium supplements, the most important conclusion I came to is this: organic forms such as lactate, citrate, or bisglycinate tend to be better absorbed than inorganic forms such as magnesium oxide. In fact, several studies found that magnesium oxide was absorbed so poorly that in some cases it didn't even raise magnesium levels compared to placebo. Because of its poor absorption, it also acts as a laxative, and it is used as a medication for this purpose. Despite this, many supplements and multivitamins still contain magnesium oxide because it has a high elemental magnesium content, it's much cheaper than organic forms, and it also takes up very little space in a capsule. For manufacturers, this is perfect, and consumers also feel reassured that they are supplementing magnesium, even though, unfortunately, it's pretty much useless. Elemental magnesium content indicates how much actual magnesium a given compound contains, and this can differ greatly between forms. Magnesium oxide is very high, about 61%, whereas some organic forms of magnesium contain less than 10%. In the past, some manufacturers often listed the total weight of the magnesium compound instead of the true elemental magnesium on labels. This meant a product could look like it provides 500 mg of magnesium, when in reality it only contains 36. That's why it's essential to always check for elemental magnesium content on the labels. Fully reacted magnesium chelates are better absorbed and more expensive, and unfortunately it's so well known in the industry that many brands use ingredients where the reaction is not completed, leaving a significant amount in the inorganic magnesium forms without being labeled as such. As a result, much of the magnesium they contain remains in the poorly absorbable forms. This not only deceives consumers, but also creates a false sense of security. For example, the well-known American company Now Foods tested 16 popular magnesium bisglycinate products a few years ago, and almost none of them contained only the chelated forms, even though their label said so. Of course, since this test was published by a manufacturer, we should remain cautious, but based on our own experience, the problem also exists in Europe. The truth is, this can only be measured accurately with very expensive equipment, which is unavailable for consumers. They can only guess if a supposed chelated form causes diarrhea, which may be a sign that the products contain inorganic fillers. Magnesium creams are also becoming increasingly popular, but it's important to know that the effectiveness of transdermal magnesium supplementation has not yet been convincingly proven, and it's unclear how much actually gets absorbed. It's possible that creams containing magnesium chloride or Epsom salt baths may raise levels somewhat, but so far there are no high-quality studies to confirm this. For effectively raising magnesium status, oral forms, for example magnesium bisglycinate, remain the best option, while creams and baths should be seen at best as secondary, convenience-based add-ons. Another common misconception is that it's useful to take several different forms of magnesium supplements at once, because one is good for the heart, another for the brain, and another for blood sugar levels, and so on. The only tiny bit of truth here is that in organic forms, the secondary compound may also have additional health benefits. For example, glycine itself has a calming, sleep-improving effect, so magnesium bisglycinate may help more with sleep and relaxation. Magnesium taurate provides taurine, which may support cardiovascular health. These compounds can be taken separately though, and they are a lot cheaper that way, so there's no need to pile up 5 different types of magnesium supplements. In fact, that could be too much. Magnesium L-threonate is also worth mentioning because many people claim it's the only form that can cross the blood-brain barrier and therefore enhance cognition. This is simply not true. Magnesium alone can cross the blood-brain barrier, even coming from other forms or diet. There are a few human studies where magnesium L-threonate slightly improves cognition compared to placebo, but in one of them it was tested alongside many other vitamins and supplements, so it's impossible to know how effective was magnesium threonate alone. Another study found it improved sleep quality, but again, similar results also exist with other forms too. So far, it hasn't been directly compared to other well-absorbed organic forms of magnesium, and all of the studies were sponsored by the manufacturer. It's probably a good form of magnesium to supplement, but it's very expensive and has a low elemental magnesium content. Therefore, a pretty large amount is needed to reach a significant dose. So which form should you choose? In my opinion, any organic form can work well that doesn't cause loose stools or diarrhea. These symptoms may also be a red flag for low-quality products that aren't actually organic forms at all, but inorganic mixtures. Magnesium bisglycinate is probably the best form if you suffer from loose stools and diarrhea when taking a magnesium supplement, as it is generally the most tolerated. If you are looking for sleep and relaxation support, bisglycinate is probably also the best choice, thanks to glycine's own health benefits I already mentioned. If you just want a bit of extra magnesium because your diet doesn't provide enough, any reliable organic form that doesn't upset your digestive system will do. Now, how much should you take? As I explained in the previous video, it largely depends on your diet. It can be useful to calculate your average intake once or ask a nutritionist to help. In Europe, 250 mg per day is the maximum amount considered safe for long-term supplementation. If your diet is poor and lacking in whole plant foods, you may need the full 250 mg. If your diet is fairly healthy, maybe 100 mg will be enough. And if you are already eating a good amount of magnesium-rich foods daily, you probably don't need to supplement at all. On the other hand, if you have a condition that increases magnesium loss, you suffer from certain digestive diseases, chronic stress, or any specific health problems where a higher dose have been proven to be beneficial, then you may need more than 250 mg. In some clinical trials, much higher doses were used for specific purposes. If you take more than 100 mg, split the doses across the day to improve absorption and reduce the risk of diarrhea. If you are planning on taking more than the recommended upper limit, always consult your doctor, especially if you have kidney disease or take certain medications. In the previous video, I mentioned observational studies showing that a higher dietary magnesium intake reduces the risk of several chronic diseases. I also noted that this doesn't automatically mean supplementing magnesium will produce the same good results. However, there are many clinical trials that looked at supplementation, so let's take a closer look at a few. One issue I would like to highlight is that many trials unfortunately use magnesium oxide, the poorly absorbed form I already talked about. Reviews often lump these trials together with the other better ones, which may explain the mixed and sometimes confusing results. With all of that in mind, let's take a look at some specific findings. A review from 2024 of many randomized trials found that doses above 400 mg per day could lower blood pressure by about 6 units in people with hypertension. Another review published this year found that magnesium supplementation can also reduce CRP, an inflammatory marker, thanks to its antioxidant effects. This may partly explain the lower cardiovascular risk seen with a higher magnesium intake. Magnesium is also stored in our bones and, like calcium, has structural functions. It also influences vitamin D, parathyroid hormone, and bone cell metabolism. A review of 7 studies found supplementation improved both bone density and fracture risk. So in osteoporosis, magnesium supplementation is definitely worth considering. Observational studies suggest higher magnesium intake protects against type 2 diabetes, And meta-analyses do confirm supplementation can lower hemoglobin A1C and fasting blood sugar levels, and also improve insulin sensitivity. A 2021 review showed magnesium supplements can help older adults with sleep disorders fall asleep faster by about 17 minutes on average, and also sleep longer too, at doses about 320 milligrams per day. A randomized placebo-controlled trial from 2024 also found magnesium significantly improved sleep quality. Low magnesium levels may also contribute to depression, and supplementation may ease symptoms. 2023 review of 7 trials found a significant improvement in depressive symptoms, and a 2024 review suggested magnesium may also reduce anxiety. Finally, although results are mixed, a 2018 review concluded that magnesium supplementation reduced the number of migraine episodes, so it may be worth a try. It's important to note that in many of these clinical trials, the doses used were much higher than the officially recommended upper limit for long-term supplementation. So if you are considering magnesium, not just to cover your daily needs, but for specific health purposes, always consult your doctor first and only do it under medical supervision. If you found this video helpful, please share it with someone who might benefit from it, and subscribe to the channel. Do you take magnesium? How much? And in what form? Do you have any questions I didn't address here? Please let me know in the comments.